Hi, everyone. Hopefully everyone can hear me okay. Thank you so much for coming to our presentation today. My name is Jessalyn Thibodeau, and today I'm also presenting with my colleagues, Elena and Justin, and all three of us work at Settlement and Integration Policy at IRCC, and all of us have kind of worked on the file we are about to talk about today, which is settlement services, what IRCC kind of has observed using our data to see the pivot of service providers during COVID-19 pandemic and a kind of move or a necessary move to virtual service delivery. So what we will be covering today is a little bit of setting the scene of what we kind of have seen within the pandemic, looking at some of the evidence that we have built up from a quantitative point of view, as well, and then looking at some of the results of a survey that we conducted that looks at the access to settlement services and then changes in the delivery of settlement services as well. And then we'll be taking a look at and getting some feedback on what's next within the settlement sector. What I will say as well is if anybody has questions during our presentation, we expect to have a pretty good kind of chunk of time at the end to discuss questions and feedback. So if you could put them in the chat or the QA function that's to the right of the video that you're looking at right now, that's the best way for us to look at them. That would be great. Thank you. So I'll just set the scene and then I'm going to hand it over to Elena and Justin. So as we know, the COVID-19 pandemic has been a huge challenge, obviously, for everybody, but in our world, for SPOs, as we call them, service provider organizations, and what we've really seen is a pretty incredible, an incredible effort to rise to the occasion. So it's obviously, been a major disruptor. What we have seen from organizations is innovation and resilience being demonstrated across the board from the very get-go. And that you can see in minimal impacts on service continuity that we've seen that Justin will talk about a little bit later. What we did as a department is we engaged early with SPOs to help support as best as we could in the transition to a pandemic world by having flexible amendments to try to help organizations procure things like computers and software and subscriptions to software, as well as PPE to continue serving newcomers safely. We did a lot of reaching out to various stakeholders to hear what they have to say. And we had set up a dedicated mailbox for questions from organizations that allowed us to get a sense of what's going on in the field and what was coming up to help us prepare and try to respond as best we can. The sector as well itself has been busy collecting best practices, learning from each other, sharing knowledge, understanding challenges, and continue to do this as environments are changing constantly. Zones in Ontario, we have zones are going from green to red in 4 days, that kind of thing. So things are changing constantly, and SPOs are doing a really great job continuing to adapt and learn from our lessons. So now I will throw it over to Justin, who will talk about some of the data that we're seeing.
Good afternoon, everyone. So the next few slides, I'm just going to talk about the data that we're seeing from the iCARE system. The iCARE system is the Immigration Contribution Agreement reporting environment. This system is used by our IRCC funded SPOs for reporting direct services to our system. This allows us to report on service usage and client information such as demographic information on our clients. So I'll just spend a little time putting some context to what this slide is showing us. So this slide shows us the service uptake of permanent residents in a given year. If you look at the first portion of this slide, if, for example, in 2018, 39% of permanent residents that landed in 2018 received a service. The green bar beside it tells us for those that landed in 2017, 26% of them received a service in 2018. So, and the following bars kind of follow the same pattern. So what I wanted to do was jump to the service year for 2020, which is the year of COVID-19. If we look at the service year 2020, you can see that the uptake rate for clients that became permanent residents in 2020 had a lower uptake rate than the previous year. After looking at some data, we're seeing that there's a couple of possible reasons for this, and it could be due to the demographics of these clients and potentially harder for some of these clients to access service during 2020. But what I really want to draw your attention to is the PRs that are receiving the service that landed last year, the year before, and then in 2018. We see that the percentage of service uptake is actually fairly relative close to the previous years. And this highlights that the SPO's ability to continue delivering services to clients that are requiring services. So we're seeing a fairly good trend. What's not evident in this slide is actually the number of clients receiving services. In the green, so the 22% actually represents around 60,000 clients receiving a service during 2020. So this is showing some good uptake. If we get on to the next slide, I'm just going to show you the transition that we're seeing in terms of service uptake to online services particular. The previous slide was all services, but now we're going to focus on the services that are delivered online. We can see a clear uptake here in March. That clients receiving services online is being shot up there. We just wanted to mention that this is the tip of the iceberg. The reason for that is because the way we collected the information has somewhat been altered because moving forward, we need to find out more information on how these services were being delivered online. So as of October, you'll notice the graph has kind of stopped in October. And the reason for this is because we've updated how we're collecting data on service delivery. If you move forward to the next slide, it's just going to show the proportion of online services by component that we deliver. So this shows the shift towards virtual delivery services by each component that our service providers deliver. We are impressed by the SPO's ability to transition service that were typically done in person to online formats, such as community connection. We've seen quite a drastic increase in community connection services delivered online. This was a little bit, I don't know if the shocking is the right word, but we were actually fairly impressed because much of these services require social interaction. But clearly there's been a shift from our service providers to shift those social interactions online. What we know, there's been a learning curve for SPO's ability to deliver these services online. And as a result, IRCC wanted to find out more about the SPO's transition. And as a result, we provide a survey, and the next following slides, Elena is going to touch base more about the results from this survey.
Thanks so much, Justin. Good afternoon, everyone. So as Justin was saying, iCARE was starting to paint the picture for us of what COVID has meant for settlement service delivery, but we had more questions that we wanted answers to. So we knew that we really needed to do our homework to be able to better understand the situation. And here are the key pieces of evidence or the sources that are informing the evidence base that will help us really understand and make informed decisions about future settlement programming. One, of course, is the sector technology task group that is doing really important work and that has done a monumental effort in connecting with so many stakeholders and many of you, I imagine, to understand what is working and what isn't working. So we're very excited to read the report and start to unpack the recommendations. And I just want to note that the sector's technology survey actually built on some of the findings from IRCC's survey that I will speak about in a moment. So it was a very nice collaborative effort there. We also have the second round of Service Delivery Improvement Fund projects, many of which will be looking at the impact of virtual delivery on client level outcomes. So getting more insight into what works and what doesn't, for whom and why, is another really critical piece of this puzzle. And of course, this information will be available, in 2 or 3 years' time, but it will be an important source of evidence to come. Jesslyn mentioned at the outset of the presentation how busy you guys have been with all of the surveys and connecting with clients and their most pressing needs and doing your own research. And the department is really keen to tap into all of that learning and knowledge. And we're collecting these reports. And if you have any more that are coming along, please put it in the chat. We'd love to take a look. Of course, iCARE and other administrative data from the IRCC side that has helped us, glean some of the early learnings from what the shift to online delivery has meant and what Justin just presented to you. It's a really important source for us. It always is. But we wanted to complement all of these different sources of information with a national survey of service provider organizations, and that is what we launched in the fall. So in October and November, many of you have received an invitation to take part in the survey, and the goal was really to better understand what was going on the ground, to hear directly from service providers, to help us make better informed decisions. In terms of the methodology, as I mentioned, many of you received an invitation. If your organization has more than one contribution agreement, then you likely received a number of invitations from us. And I just want to take a moment here to really thank you all for participating, because the response rate, 4% of contribution agreement holders responded and took time to complete the full survey. And we know that it was a major time commitment on your part, and you really took time to outline what is working, what isn't working, and why. And we really appreciate all of your time and effort, and this information has been vital for us. So as I said, we got a 54% response rate, which represents 342 contribution agreements. Response rate was equally high for Francophone organizations. And when you look at the response rate by region, you can see there's a little bit of variation there, but overall, it's a very representative sample for sure. The really neat thing about this survey is that it's linked with administrative data at IRCC. So we can link your responses with, iCARE data going back to last year and the previous years, which will be helpful for us as we dig deeper into the impact of COVID, for example, on the number of clients that you're able to serve, and to really better understand what are the challenges, but also what are some of the successes and what groups are you able to serve more easily in this remote virtual context. One of the key findings from the survey is the extent of the pivot to virtual service delivery. So, we all knew that all of us kind of had to change the way we do things, and this happened in every industry. But it was really impressive to see those numbers from the survey that we went from 58% of SPOs providing some services virtually, either online or by phone, before COVID, to 97% of SPOs providing virtual services. And Francophone SPOs, it's a similar story, although the numbers are a little bit different, going from 65% to 93%. And what we saw from our survey is that the vast majority of SPOs are providing some sort of services virtually. And out of the total sample size, only 10 SPOs did not provide any virtual services. 20% of them said that it was too difficult, and we have the reasons listed here on the slide. So the 20% represent 2 SPOs. So this just highlights the extent to which the sector has pivoted, but also I think it really underlines the effort that SPOs have put into ensuring that they're able to connect with their clients, no matter what the level of restrictions are in the area that they live, whether they're providing services online, whether they're dropping off services at a client's home, etc. We're going to get into all of these neat details from the survey. So in terms of the program streams or components that are most being delivered online. So when we say online, we're talking about a live session, very much like this one right now, where you have a settlement worker logging into Zoom and connecting with clients directly. So the settlement program components that are most delivered online, again, this is from the survey. So this is a kind of a picture in time from mid-October until early November. So we're cognizant that some of these things maybe have changed, have evolved, but we can talk about this, a little bit in the Q&A. So we have library settlement partnership, for example, that came out very strongly. All of the SPOs delivering LSP programming said that they're providing some services virtually. Then language training, which was not so surprising to us because we know that language training had been providing some classes online before the pandemic. Community Connections was also a program stream that saw a lot of virtual online delivery. And I think this goes back to Justin's point about the need for that connection and that human contact during the pandemic. Perhaps that has even intensified the need for community connection services. And I&O and employment-related services are very high as well. There are also a lot of components that are being delivered mainly by the lo-fi methods. So it's either through phone call or phone text or by email. So this is mostly used for clients that either don't have access to a device, or they may not have a good internet connection at home. And here we have case management, NARS, information and orientation, and settlement workers in schools. And of course, these types of streams, we know from the clients that use these streams that, they may share certain characteristics and certain vulnerabilities that may dictate this choice of delivery. And there are a lot of components that are being delivered in person, of course, respecting social distancing requirements and the public health guidelines, but we have case management, Swiss, and language assessments that were being delivered in person in a lot of cases. As we move on to the next slide, we're not going to unpack this graph. It's mapping out all of the different methods of service delivery. So on top of the online staff-led, the blue bar, which is the live Zoom session, the green bar, which are, that's the lo-fi option of the phone call, text, or email that we talked about just now. You also have the gray bar, which is when SPOs would provide materials to a client either on a USB or a hard copy and drop it off at the client's home. You have the orange for in-person and the yellow for the self-directed, which usually means that it's either a client is being directed to a self-recorded video that they can access on demand, or they can access documents from like Dropbox or another service. What this tells us really is that SPOs are using a mixed method approach to deliver settlement services. So I think, again, that highlights the kind of nimbleness on the part of the SPOs to really be able to make it work no matter what the barriers of the clients are and the current public health guidelines are. So when we look at a little bit at the opportunities that the pandemic has brought for SPOs and some client groups, we did see that some clients are able to access services more easily. And overall, we see that for the majority of respondents, the share of their clients that is unable to access virtual services is really small. So when we look at the blue, that pink and the green bars combined on the graph, that represents 66% of respondents. And for these 66% of respondents, less than a quarter of their clients had difficulty accessing virtual services, which I think is a positive story. And you have 15%, the bar in the pink on the very right, for whom all clients were able to access virtual services. And here we're looking at the types of clients that had an easier time in terms of accessing services. And, perhaps this does not come as a surprise to you, that economic principal applicants in the blue, their spouses and dependents in the pink, are having an easier time with virtual service delivery and accessing virtual services because a lot of these clients have high official language literacy. They also have high digital literacy, and they have an easy access to a device or several devices at home, so they don't have the problem of sharing. What came as a little bit of a surprise to us is the number of respondents that said that, it's actually easier to serve refugees virtually. And some of the reasons that were provided were that refugees don't have to deal with the transportation issues, and refugees no longer have to think about childcare. So all of these factors were a little bit easier to handle in the virtual context, which has enabled certain subsets of refugees access services more easily. However, we know that the pandemic has exacerbated existing barriers. We've heard it time and time again, and we were not at all surprised that the client groups that the SPOs have identified as those reporting the most barriers and facing the most barriers in accessing virtual services are really the same client groups that have been facing other barriers in the years before COVID. So we have seniors and women and government-assisted refugees, and followed by racial minorities, really, that are the groups that have been most disadvantaged or have had to overcome, the most in terms of being able to access the services they need in the pandemic context. So for us at IRCC, this really means that not only do we need to be thinking about ensuring that all of those supports, like in-person services, et cetera, are there for these client groups moving forward, but it also brings up bigger questions about, digital literacy and digital skills training and what we could do to help support these populations moving forward. And to talk a little bit more about what these groups of clients actually mean in terms of iCARE numbers, I'm going to turn it over to Justin.
Thanks, Elena. So just to kind of pick up on kind of the topics that you were talking about, what we wanted to do in this the next couple slides is kind of give you guys a snapshot of what our client profile looks like for the clients receiving settlement services from the iCARE perspective. So what this is just doing is it's, on the slide on the left is just showing us the immigration category breakdown of our clients. Elena kind of mentioned the economics and their ease of use of online services. So we know they account for about 41% of our clients. That leaves around 60% of our clients that are not economic immigrants that potentially have additional barriers in receiving these services. We also have the gender breakdown to the right, and it's showing that 56% of our clients are female, and then the 44% are male. What this slide isn't showing, but I just wanted to pick up on some of the notes that Elaine had mentioned, is in regards to refugees. When we look at the data in terms of service uptake, we have noticed a large increase in service uptake for refugees in the use of online services. They used to be fairly below in terms of economic category usage, but during 2020, they have seen quite a big increase, and they're using online services in line with our economic counterparts. If you can just go to the next slide, it's just showing a breakdown in terms of our age categories of service uptake. Elena had mentioned talking about seniors and their digital literacy and ability to use online services. So again, this is just trying to put the data in perspective in terms of what our clients look like and allows you guys to see how the breakdown is from a demographic perspective. The takeaway here is more work needs to be done to better understand how populations facing barriers may overlap, as we mentioned, such as senior women. On to you, Elena.
Thanks, Justin. So we're going to zoom out a little bit and look at some of the other questions for a moment. We were talking a lot about clients, but COVID-19 has been a huge shift for SPOs and SPO staff as well. And as we talked about, client digital literacy, the survey also wanted to probe the question of the digital literacy of SPOs and their staff a little bit further. And after all, they're the ones on the front lines delivering the services. So their digital literacy and, really supporting their capacity on that front is just as important. So what we saw from the survey is that, for program managers and, the the digital literacy is not really an issue. There's really high, very high literacy. So when you look at the green and the red bars for program managers, so that's the histogram on the left, you see how high that percentage is, about 83% saying that they're extremely able and comfortable with all of the digital tools and technology. Of course, there's, a little bit of reinforcements that is needed, but that's a positive story. When we look at the data for frontline staff, the numbers are a little bit different. So as opposed to 83% for program managers, it's 67% of frontline staff. And of course, here we have the question of frontline staff are not the ones answering the survey directly. So, we can talk about maybe some of the biases that may be influencing these numbers. So I'm sure that, on top of being self-reported, there are a lot of nuances to this data. But even from this little snapshot, you can see that frontline staff, they need more reinforcement and professional development in terms of their digital literacy skills. And we know that SPOs have already done a lot. They've been super busy from, the time that COVID hit, really ensuring that their staff has the tools, has the hardware, is able to deliver the services and the training to their clients online, to be able to collaborate in this virtual environment. But there's more that is needed. In fact, our survey indicated that 75% of service provider organizations feel that their staff need more professional development to be able to continue to serve clients virtually. And a lot of it has to do with the ever-changing tech environment as well. There are new platforms and tools that get developed, that improve on, whatever we've been using beforehand, and you want to switch the platform, so you need to train your staff, and it's a cascading effect because then you also need to train your clients. It's interesting that this number is something that the Tech Task Group also found in their preliminary report. So, we're aligning in terms of this finding, and we're really looking forward again to the final report from the task group to learn more about, really the areas that need particular reinforcement from SPOs, and we'll be paying a lot of careful attention. Now, another important finding that, kind of highlights the silver lining of the pandemic, but also demonstrates, again, how SPOs have been able to really capitalize on this challenge and innovate and really make good things happen for newcomers. It's the number of partnerships that have been formed by SPOs with other organizations. So, of course, there were a lot of partnerships with food banks because of the increased food insecurity and overall financial insecurity that has been brought on by the closures and the lockdowns. You have a lot of cooperation between SPOs and local health units, mental health providers. That was another important theme that emerged in the partnerships, as well as organizations that are providing interpretation services for newcomers. So all of these new partnerships that have been formed, and again, they're a testament to the hard work of service provider organizations. And really, we hope that some of these partnerships will stay, because a lot of these organizations maybe haven't had the experience of working with a lot of newcomers or some of the really vulnerable newcomer populations. So it's been great in terms of raising their awareness and helping them be able to really reach out to the newcomer sector and integrate them in their programming. All right, now we're going to shift back to service delivery for the last two remaining slides, and we're almost done our presentation, so it'll be time for questions. In our survey, we did ask service provider organizations to give us an indication about whether or not they would like to continue delivering some services virtually, in the future, once COVID is done and we don't have to do this anymore. Is there a reason and a point in delivering some services virtually? So this graph shows us the answers to that question from SPOs, and we're, it may be helpful to look at the two blue graphs. So, so the dark blue, which is a yes, we want to continue doing what we're doing now with no changes, which of course, was not that high, understandably. And the lighter blue, which represents the SPOs that said, yes, we want to continue delivering services virtually, but, we do want to change some things because, some things need fine tuning and, we need to switch to a new platform, et cetera. So I think, there are different ways that we could read this data. For me, I think this shows that there is an interest in virtual service delivery, although it varies by component. And we see that some components maybe are better suited to this virtual context, and the client groups that they serve are better able to pivot and really get the most of this virtual environment. We also know that likely there was a little bit of hesitation when answering this question from IRCC, the funder, in terms of, what does this mean? IRCC firmly believes that we can't and we will not be switching to a 100% virtual delivery model. That's unrealistic given the clients that we serve. But I think that we are interested in seeing whether there is a certain subset of clients, like maybe it's the economic principal applicants and their spouses and dependents, that really have been able to access services that they weren't accessing before because they didn't have time or whatnot during the pandemic. So maybe this is an opportunity to create a suite of virtual services to better serve that group. So that was really the crux of the question. And interestingly enough, what we learned is, yes, so there's potential for a future virtual service delivery, but that virtual service delivery really needs to come hand in hand with an in-person component. So when you have a virtual class, you also need to have either an in-person assistance, or you need to have the same class to be able to be delivered in person for those folks that either don't have the official language literacy or don't have the digital literacy or don't have access to a device, which would inhibit them from really taking part in a virtual session. So for some, virtual delivery is an interim measure. For others, it's something that may continue post-pandemic. But I think for most SPOs, with the exception of, pre-arrival, in-person components will be something that will be necessary moving forward. And with that, I'm going to pass it over to Jesslyn to conclude.
Thanks, Elena. So just kind of as our last slide here, we'd like to open it up for questions or comments afterward, but we'd like to talk a little bit about how do we continue to use these survey results to continue to support the settlement sector. And I think the kind of message has been clear that we do have some preliminary results here, but further analysis is necessary to really dive in. So like Elena mentioned, linking the survey results with iCARE, to take a look at those client groups that have kind of come out through the survey, and seeing if the answers to the survey were different from organizations who served more or less of these client groups. Again, Elena has mentioned as well, looking forward to the final report of the technology task group and their recommendations, and kind of seeing how they align with our findings, and to figure out a way forward to best to support the sector in this kind of new world that we're in now. And the last is to really explore the impact of virtual delivery on client outcomes. So we're looking right now at kind of who is continuing to access services, but the next kind of logical step is to see who those are actually working for, if it's some populations over other populations. So there's a few options for this, including new service delivery improvement projects that could help us advance our understanding of which populations virtual service delivery may work more, or maybe not as well for. What we're looking for, so just some questions for you guys to think about, and to put things into the chat. If there are questions we can answer right now, and then the chat will stay up as well, so the three of us can go in and take a look at what your feedback was in the chat. So even if we don't address it, it's still super valuable for us, so thank you very much. What we're kind of looking to understand is how are new developments in the pandemic impacting your organization, how your organization thinks about future service delivery. So we live in a world of vaccines now, they're being rolled out at different speeds across the country. How, looking forward to kind of, I dislike the term new normal, but in the new normal, kind of where's your organizational thinking going around the future of service delivery? What other learnings? The survey was done October, November 2020. So since then, what additional learnings has your organization come across, especially around vulnerable populations? Like we've mentioned, some of the populations remain our vulnerable populations. So what have you learned around those specific populations? And then also, is there a need to engage with organizations through another survey? Thinking about now this is kind of our normal, we're out of the kind of transition phase of the pandemic. So that was kind of how the first survey was responded to. So now again, thinking forward, thinking more longer term, do you think it's worthwhile for IRCC to do another survey? And one quick note that I'll say about surveys is that we here at IRCC understand the value of digging deep into an issue, talking to organizations, leveraging all of the other engagement that occurs within the sector. And it's something that kind of at a national level, within the department, surveys are sometimes the easiest way for us to get at that really high level information and to really understand what's happening across the country. But I do just want to make it clear that we don't think that that's kind of all of the information we ever need. But for us, what we're wondering is getting another sense through another survey that is similar to the survey that we conducted in October, if you think your responses kind of would have really changed between October and say summer 2021, that's kind of what we're interested in, to see if there's value in doing that. And with that, I will open it up for comments and questions. Elena, do you want to?
Yeah, I can take that one. So the survey was mailed usually to the executive director or the person who signed the contribution agreement with IRCC. And I know that some of them kind of delegated. So it was the program manager that, for example, if your organization had several agreements and one agreement was for community connections, so it would be the program manager for community connections answering the survey, but not always, right? So frontline staff did not answer our survey questions. So that's what I said when we looked at those digital literacy for frontline staff numbers, there may be something different that's going to come out from the tech task group, which actually engaged with more frontline workers. So that's why it's really important for us. It was important for us to collaborate with them and ensure that our questions are complementary, but we know that they had the ability to dig in deeper, to hold those consultations and, those conversations, really, to be able to get to the issues and unpack them a little bit.
So I'll just read out the next question in case people can't see them. So the next question is, of the SPOs who responded, how many were rural? And what were the differences in their answers? Were rural providers more likely to want to keep virtual services? So again, I'll throw that over to Elena.
So in terms of rural service providers, and at IRCC, we don't have an easy definition of rural or urban. So I think it's, looking at some of the medium or smaller size centers. So that would be one of the categorization that we would use. In terms of the barriers, rural was not a major barrier identified. So it was a barrier for 4 to 5% of respondents. So it's a really, minimal number, and we didn't see a big difference in terms of the other main high level results that we presented. But for sure, we know that some of the feedback that we've received in terms of service providers in rural areas, they've always faced additional challenges which have not been made easier by the pandemic. So we're listening intently, and we know that there have been reports coming out from the sector that have been able to kind of survey those rural SPOs in greater detail. So we're expecting to hear more about the difficulty and the challenges, but we also know that even rural SPOs have been able to kind of overcome, and I've heard stories of rural SPOs being able to connect with their clients better in the virtual environment.
So the next question is, did the survey ask about the quality of service delivered virtually? Do we know how efficient and effective virtual service delivery has been? So I would say this kind of speaks to the point on the slide here around the impact on client outcomes. meaning the effectiveness of the survey, of the services in a virtual format versus other formats, is one of the areas of further analysis that we will need to look at. And I would say, thinking about the pandemic and the timeline, we're kind of just now getting into a world where we can understand some of the longer term outcomes. So not just are they receiving a service, but is it making an impact on their lives? So I think that we're just now getting to a point where you can actually start to look at some of the outcomes of the services. And I don't know if Elena or Justin, if you wanted to add anything to that.
Yeah, I'll add that, for IRCC, that's a really critical question. We are extremely interested to see whether or not, in terms of, the impact and the effectiveness of the services, whether it's comparable, whether virtual delivery is comparable to in-person delivery, or whether, there are some major gaps. Perhaps there are no gaps, perhaps, it makes certain things easier. But we're really looking intently to see the data. And like Jesslyn was saying, it has been too early. Right now we're at the 1 year mark of the pandemic. So I think, we'll be able to kind of leverage some sources and look more deeper into what this has meant for the effectiveness of services. But we're not just looking at the efficiency question. It's really how the two of them work together. And that has been our approach all along to virtual delivery.
The next one I'll just read. Access to affordable internet continues to be a barrier for many vulnerable newcomers. We know that it's an ineligible cost under our contribution agreements, but this concern needs to be addressed if virtual service delivery is a priority for IRCC. So I don't really know if there's a question in there, Elena, but I don't know if anyone wants to address that.
So I know that, Settlement Network, which are our operational colleagues in the field. So these are the program officers that you would deal with if you have a contribution agreement with IRCC. They have been working hard to be as flexible as they can in the pandemic context to allow burner phones for clients. And, I know that IRCC has helped with hotspot lending and things like that. So certain costs related to internet connectivity. I know that some are ineligible, and we're not experts on that because we're coming from the policy side of things. So I apologize for that. But I know that SN Settlement Network has really worked hard to do the best we can within the realms of, and the frameworks of financial accountability and the rules that we have to follow government-wide.
So the next question is, did service providers notice an increase in clients and services because they were able to reach clients outside of their geographic reach? I think I'll jump in a little bit. I think that that's a really, really interesting question, and that's something that we need to look at. And that is where using kind of our iCARE data and getting, we collect a lot of location data within iCARE. And I think that's something that we can start to look at a little bit more closely now that we have a full year of data. I don't know, Justin, if you wanted to add anything to that.
Yeah, I'm just going to pull up some actually data I have. We have seen a small decrease in the number of clients served in this year compared to the previous years. To be honest, other than those that landed in this given year of 2020, we've seen very consistent service numbers in terms of the effects on our client base. I don't have all the numbers, but from a consistency standpoint, I don't think we've increased, but we've stayed pretty much static with a slight decrease, I guess you can say.
And I think that's a very good question that we would look at going forward, because I do feel like the virtual service delivery we would have experienced in the past year was kind of, in theory, a temporary measure, right? So things would have just continued as is, and organizations probably were serving the clients that they kind of had already been serving. And in a world where virtual service delivery may become more of the norm for certain programs or certain populations or something like that, how does that happen? And how do we deal with that, and what clients access which services? I think is a really interesting question that we're looking forward to looking at. So the next question is, are there any plans of making digital skill training that IRCC recommends should be integrated into the service delivery of programs if we move forward with a more hybrid model? Elena, did you want to talk about that?
So, I mean, part of the answer to this question is we're looking and waiting for the recommendations of the Tech Task Group. That was really one of their main objectives, to look at the digital skills and what else is needed in terms of the professional development for SPOs and their staff and for clients. In terms of programming, we know that the Visible Minority Newcomer Women pilot has and will have a digital skills training aspect to it. So that's one of the programs that that is really looking at how we can better position and better equip newcomer women for this new world. But yeah, I mean, the question of digital skills is something that the department will be looking at closely, and for sure it's high. It's a big question in our minds, and you know, we look forward to hearing any insights and any learnings from you as well.
So the next question is, what category is pink on slide 15? So I can look that up quickly here. Oh, that is missing. That's a good question. Elena, do you know?
Let me see if I can pull that up right now. If you give me 1 second, maybe if you want to get to if the next question, then I can look it up.
Yeah, let's do that.
So I got it. It's protected persons.
Protected person.
I'm not sure why it's showing in the label. It's showing
I think in the
blue, but it is pink.
Yeah. So it's protected persons. Good question, thank you. So number 8 is, I wonder if language provider SPOs are delivering services online to meet IRCC needs, but are neglecting to pay attention to the client's needs. For example, is IRCC or any SPOs teaching stage through thought about dropout rates, and are they higher? So I can touch on that a little bit. And again, like I said, we're really looking at outcomes kind of starting around now, where we have enough information about enough clients to really start looking at outcomes. And the secondary thing that I would mention is that the data that we provide, or the data that we have in iCARE and in our other administrative data sources, what that provides us, like I said before, with any other type of kind of survey or high level, is just the high level view of things. And if we are interested in looking at, for example, stage 2 teachings, that is an area of research where we would kind of dive in a little bit deeper, talk to organizations and clients and all of that other things. So I do want to say our administrative data kind of helps to point the light towards something, and then we kind of dig deeper and look at what we can find around there. And between, I mean, clients' needs for us is always about the outcomes of services, which is what kind of we're focused on, and how we are choosing to drive our policy, which is, are things, going back to the effectiveness and the efficiency questions, are services effective? And looking at that and helping to guide organizations and to guide the program as a whole as we move forward. And I don't know if Elena or Justin wants to add anything to that. Nope. All right. We can move on. So the next question is, did any SPOs find connecting with clients difficult using virtual programming? I'll give that one to Elena.
Yes, absolutely. And I think, you know, we kind of talked about the challenges and certain groups of clients that SPOs have had a harder time reaching virtually. So again, it's the seniors, it's the women, it's the government assisted refugees, racialized minorities. So what we'll be doing at IRCC is kind of looking at how these characteristics intersect, and whether it's, you know, more the case of senior women that are being more left out, or are these, you know, women that are members of a racialized minority. So we'll be looking at the intersectionality of these characteristics, because I know that that's an important factor. But for sure, yes, you know, certain client groups are much harder to reach. I attended a presentation earlier this morning where there was a SPO from Ottawa talking about how hard it has been for certain group vulnerable group of newcomer women that don't have the official language ability to be able to reach out and access services virtually. Simply like the language barrier, you know, the services are only available in English and in French. And if you are not fluent in those languages, you don't feel comfortable speaking those languages, then you're not even going to want to go and try to access those services. So there are a lot of issues that, you know, are being surfaced by SPOs in terms of, you know, yes, you have your vulnerable populations and you have these barriers. What does this actually mean? So I think a lot of work needs to happen from our side in terms of really unpacking all of these findings and finding a better way forward that really helps to support, especially the most vulnerable.
Okay, next question is, did the survey include questions about the need to update training curriculum and service providers' ability to implement these updates?
So it would be great to get a little bit more context for this question. I'm not sure what program component we're talking about, but in general, the survey, because it was a national survey, that tried to paint a picture of all the program components for the settlement program. We didn't really get into the weeds and asking these questions about the training curriculum. So we didn't have the opportunity to really ask pointed questions for each program component. That, you know, we kind of had to balance between, you know, needing to do a national baseline. That's what we did. And we're hoping that through iCARE, through some of the other sources that we talked about earlier in the presentation, through the tech task group, and, you know, through the reports and the surveys that the sector is doing itself, we're going to get some more nuggets. And of course, you know, we're thinking about what strategies we're going to do in terms of engagement with SPOs to get at some of the other issues that you're raising here.
Sorry, I'm just waiting for the next question. Okay. Online service delivery should be less costly to SPOs and to IRCC. So given the results presented and that some groups use more or benefit more to online services, how should IRCC change how resources are assigned to different groups and service categories? So I think Elena kind of already talked about this when we were talking about the slides for whom there seem to be fewer barriers to accessing virtual services and some unexpected findings like around the childcare and the transportation issues that people like refugees were experiencing. So I think that this is kind of all tied together, but again, what we are looking for is the effectiveness of these services. So even where it says use more or benefit more, what we'd really like to confirm is that people are benefiting more. So it might be easier to access for some, but just kind of following that down the line to make sure that they're benefiting more from the services as well. I think from a purely access point of view, we can see where some of the challenges have actually been removed for certain populations. But again, trying to balance those vulnerable populations or the populations for whom challenges have not been removed. That all is things that we're kind of trying to weigh as we go. So I think we can take the next question. We have a couple more. We have about 6 minutes left, so we should be able to fit it all in, which is great. And again, if anyone has any comments that are not questions and are kind of learnings or things that they did, to put it in the chat and we'll go take a look at it after our session, and it'll be available for a little bit longer as well for everybody. So we're really interested in your feedback. So the next question is, access to digital devices for clients has been reported as a major barrier. What did you learn about this in the SPO survey? Elena.
Well, I think, you know, yes, access to digital services for some has been a barrier, and we talked about those client groups just now. The other side of the coin is that for other client groups, it actually has been easier to access virtual services due to the fact that they don't need to travel, like a lot of clients that, would live really far away from the SPO. And I'm based in Toronto, and I've heard many, many stories of clients traveling all the way from Mississauga to the other end of Toronto, like to Scarborough, to access services at a particular SPO because they've heard by word of mouth that, this is a great SPO and they really do a good job at X or Y service. With the pandemic, you didn't have to do that 2-hour commute or whatnot. So I think for sure that it has facilitated access for some, and that's what we saw in the survey as well. So I think there are two sides to this story. I'm not trying to de-emphasize the fact that there are barriers for sure. We know, absolutely, but it's about trying to see like what has worked well for whom in the pandemic and trying to capitalize on that, because we know that the sector has innovated a lot and has really kind of been pushed to innovate in ways that we weren't planning or thinking about, but SPOs have done a really good job. So it would almost be a shame not to kind of take those learnings and best practices and do something neat with them for certain client groups.
Okay, and the last question we have is, any surveys on service users that stand out in terms of satisfaction levels from services received? So typically, so I can talk a little bit about the survey that was done with clients in the middle of kind of November of last year, which was IRCC's annual newcomer outcome survey. And on that survey, we do not ask satisfaction. So what we ask is whether or not their skills or knowledge has improved. And then we do ask if an organization has helped them improve those services, but we don't necessarily ask satisfaction. And again, this links back to something like the effectiveness of the services, and tried to parse out someone being satisfied with the service and someone with the service being effective, and making sure that we don't kind of cloud those two things together. So it is something, it's not that satisfaction is not important, and it is something that we do get into when we're going into things and doing things like case studies or really specific studies on a certain intervention. We would certainly ask something like that, but it is it's not something that was directly asked in any of the surveys that we have done thus far. We do have one more question I can see, and I will take it. We can take it. I think we have a little bit of time. It is, with the outcomes of this survey, is IRCC going to change anything in the future to support SPOs in providing online services? So I think I can take kind of a higher view on this. The work is just getting underway now to figure out what service delivery will look like in the future. And again, I think a lot of the data that is pointing to kind of a hybrid model. So maybe for some populations or for some specific services, the virtual might be more of a preferred method, and keeping the in-person in there for many populations and many services as well. So with any policy changes or any changes to the way that the program is delivered, IRCC would be, trying our best to support organizations in this new mode of delivery. And so I don't know if Elena, you have anything else to say about that?
No, I'll just say that, we're looking at, what changes would make sense, but I think it's down the road, and there's a lot of work that needs to happen in terms of looking at the different pieces of research and reports that are coming out from the sector, but also from academia, etc. So there's a lot of work that needs to happen before anything moves forward, and IRCC would always consult with service provider organizations before making those changes. So that's all. And I think that was our last question. So thank you everyone who tuned in. Thank you for the very, very thought-provoking questions, and I wish you all a great conference.
Thank you.